Hey future coders, are you trying to specialize in IP-DRG rather than being in HCC? And do you want to make high money in medical coding? In this video, we are going to give you the complete guidance on the entire shift from HCC risk adjustment to IP-DRG hospital reimbursement. We will unlock the 4 pillars that control the money and master the mindset flip. My name is Roshan Wankhade and it's time to level up your coding skills. So let's begin. As we are talking on the biggest change in inpatient coding right now, the jump from HCC coding to the IP-DRG reimbursement. This isn't just a new rule, it's a whole new game. Let's nail the 4 secrets, the 4 pillars that controls every dollar the hospital gets. Think of this way. HCC goals was to look forward to predict next year patient risk and costs, while IP-DRG's goal is to look at one episode paying for this single hospital stay. So the focus changes from grabbing every chronic condition to identify the one main reason the patient was admitted. Every DRG stands on these 4 pillars. Master these and you will master the code. The main reason, the principal diagnosis, is the first pillar. This is the most important discussion. The principal problem or the PDX is one condition established after study that caused the admission. For example, a patient comes in with chest pain. We can't code that. After test, the doctor confirms an acute heart attack. That MI is our PDX. The IP-DRG mindset is what is the one reason they are here? The pillar 2, the boosters, that is secondary diagnosis. These are coexisting conditions that make the hospital stay harder, longer and more complex. We look the CCs and MCCs, that is the complication and major complications, because they are the payment boosters. For example, the patient has pneumonia, that is our PDX, but they also have severe sepsis and MCC. That severe sepsis diagnosis will drastically increase the reimbursement weightage. We also track the POA, that is present on admission indicator for quality tracking. The pillar number 3, the big dollar major procedure. This is the biggest learning curve because it includes ICD-10-PCS. PCS is only for inpatient hospital procedures. The patient with the heart attack, that is MI, now gets a coronary artery bypass graft, that is CABG. That procedure will immediately shift the DRG to a much higher paying surgical category. The pillar number 4, it is demographics. The groupers software also checks things you can't code, that is age, gender and discharge status. If the patient is transformed to a skilled nursing facility, the payment for the hospital stay might be reduced. It is due to the post-acute transfer policy. Decoding ICD-10-PCS. ICD-10-PCS, it is visual 7-character coding graphic. This new code set ICD-10-PCS is powerful. It is always 7 characters and is built like a structured language. You have to know the 7 characters. The first is section. It is medical or surgical. The second is body system. It may be heart or great vessels, like that. Third, root operation. What the doctor did, that is the root operation. Fourth is the body part. Fifth is the approach, that is how they got there. Then sixth is the device. Seventh is the qualifier. That's it. This was all for the day 1. To prepare for day 2, read ICD-10-CM guidelines, section 2 on the principal diagnosis, then memorize those 7 characters of the PCS structure. Next time we will dive deep in root operations, the absolute heart of the procedure coding. See you there. Bye bye.